viewers, I welcome you to Word of Life with Padre Okoromi Paul. I want to thank all of you who have been subscribing to my YouTube channel, who have been following us on Facebook, Instagram, and also on Twitter. I thank you all for the effort you are putting towards spreading this message. Today I have with me Dr. Ini Ekong. Is going to be enlightening us on some of the misconceptions that follow the COVID-19 pandemic. Doctor, you are welcome to Word of Life with Padre Okoromi Paul. Now, there are so many misconceptions. There are much there in the mass media, in the social media, even among the common people. Misconceptions everywhere. Can we say that the pandemic is over with the lockdown being eased off?
Thank you very much, Father. It's my pleasure to be on your program.
You're welcome.
And I think it's a very good opportunity to, put some facts straight about not just misconception, but there are a whole lot of misinformation.
Okay.
In fact, there's what is now called infodemic. Infodemic,
okay.
Which is even as bad or even worse than the pandemic.
Okay.
So infodemic is sort of a spread of misinformation that in such a way that it is taking the focus away from the real problem.
Okay.
So it's a whole new field by the WHO. Now it's called infodemiology.
Okay.
The study of infodemics, because it's critical.
Okay.
That this is something that has to do with population.
Okay.
So it's very important, their beliefs, their knowledge, their attitude, and their practices.
Okay.
Is very, very important in containing the COVID-19 pandemic. So it's a very big opportunity for me to, at least from the little that I've been involved in, to share, my a bit of information on what is really going on.
Okay, so one of the common misconceptions now is that as the government has every other activities, that the pandemic is over. So what do you have to say about that?
Well, I would say the pandemic is far from over.
Okay.
Basically on two prongs.
Okay.
The first prong is historically.
Okay.
Like the influenza pandemic of 1918 to 1920.
Okay.
And even a whole lot of pandemics that have happened before then.
Okay.
There's always been a second wave.
Okay.
And it's happening right now in America, in South Korea, in all over Europe and Americas, So it would be a very serious mistake to say that the pandemic is all over. The pandemic is far from over. That's one, historically. Then scientifically too, you cannot really say the pandemic is over, because presently now we've only tested just below 500,000 in Nigeria. That we have like 200 million people, and we've only done about 400,000 plus tests. So you can't really say, every day people are being diagnosed, people are dying, people are dying every day. So the pandemic is not yet over.
It's still ongoing.
But probably, the government, if you follow the trend, in the pandemic response, you will see that the government's response has been in phases. The easing of the lockdown has been in phases. So right now we are in the phase 3, which means that there are some activities has to reopen, but not at the full capacity, like the gardens, the event centers, the cinemas. They are supposed to open, but by 50% capacity. So it's the reopening doesn't imply that the pandemic is over. it's just a way of also opening, because there's also an aspect of the economy. You know, some people say, you know, people are dying more from hunger. You know, so there need to be a balance with the response, and also allowing, you know, because if people are hungry, they can't stay at home.
Yeah, it's true. Yeah.
They wouldn't even hear you if you ask them to wear masks or to wash their hands.
But when they have eaten very well,
then they can hear you now. So.
Wow, thank you very much, sir. So there's another misconception about the virus that people will say that you should show us one person that has the virus before we can believe.
Yeah, Father, it's very, very interesting, because I think yesterday I heard, I think it was a music or so, that she said, show me someone that has, you know, COVID-19.
Okay.
And they said, no. And then, okay, show me someone that knows someone that has. Now says, show me someone that knows someone that knows someone that has. I mean, it's a common balance now, but it's quite sad, you know, because, I mean, it's clear now that so many people have had, you know, and it's very public figures. If you start with the federal government, Abba Kyari, you know, chief of staff to the president, did not only have, but he died from it. Governors, you know, a lot of people, highly placed people, senators have had it. It's all about the, you know, public domain. So I don't think, I don't want to believe that there's anyone that has not been. If you are not infected, at least you are affected. You know, you can either be infected by the disease or be affected. Affected in the sense that you've heard about it. You know, whether you believe it or not. And then this is, you know, it's almost impossible. If not, it's impossible to deceive everybody at the same time. You know, you can't deceive anyone. So what is there, and it's there for everyone to see.
Okay, so that the answer you just gave now actually prompted another misconception that the government is actually using this medium, or those like the NCDC, is actually using it as a medium to steal money. I don't know what you have to say about that.
Well, I don't think any reasonable person will say that you will use disease to steal money, because even NCDC, their staff, they're getting down with the, you know, with the infection. And if you look at it now, since the last 7 months, since February when we reported the first case in Nigeria, if you look at it, there's almost the country has come to like a standstill. All the resources have been channeled towards you know, fighting the pandemic. So I don't see. I mean, if we were to eat money, you know, like they say, I think there are other easier ways.
You know, maybe the reasons why they are saying it is maybe because, for instance, the palliative and all these other things that happened that period, that people did not really get access to some of those things. Maybe.
Yeah, basically, and I don't want to blame anybody who thinks so. The truth is that it's not NCDC is not using it to make money. You know, it's real. You know, but again, I don't want to blame somebody who has that conception. You know, because, you know, like I said before, in infodemiology, you know, you look at you seem to compare the virus, the pandemic, and the information spread. So if you pick, for instance, for the pandemic now, if you say surveillance, you know, surveillance is like watching over, and picking up any suspected cases. So in pandemic is surveillance, but in infodemics is listening. That's where you can pick up, do you understand, information, misinformation. You need to listen to what people say. People have a right to express, you know, their opinion about issues. And then when you now look at, for pandemic disease, the disease itself, the relative term in infodemic is distrust. So in misinformation, the disease is distrust. The citizen distrust to the government. Okay. You understand?
Okay.
So that distrust, already there's been distrust. Of course, over the years, there's poverty. Nigeria is poverty capital of the world. There's a lot of people have lost hope. So that distrust in government, is what is finding
such a misconception
that they want to eat money and all that. Money, okay. And I think, it's become a very difficult problem in managing, people's attitude and practice as regards containing the pandemic, especially in Africa and the third world where there is corruption, there is a whole lot of distrust between the citizen and the government. Compared to Europe, for instance, in Sweden, there was no lockdown because people believed the government.
Okay.
There's no.
So as the government just said.
Whatever the government said, people did.
Okay.
Up till now, there's still no lockdown. There's no enforcement of wearing face masks in Sweden.
Okay.
But government just said keep physical distance. Okay. Don't go to gatherings more than a certain number. Don't shake hands. Don't hug. And all that. And people, so it's not. I don't blame anybody, but the truth is that it's not. It's not an avenue to steal money. Definitely.
Okay, so there's also another misconception that the number of cases reported is fake.
Well, I don't know how fake.
That they are not accurate. That they are just adding figures to make up those figures there.
Well, if someone says the numbers are not accurate, there are two things that implies.
Okay.
It's either they are not counted enough.
Okay.
That they are underrated, or they are overrated. That's what it means.
So in this case, maybe the figure is underrated.
So from my understanding, people feel that probably the numbers are too high, higher than. Do you understand?
So they should bring it down.
So, but to me, I would say, if I would say it's even inaccurate, I would look at the fact that this is underrated.
Okay.
Because let me give you an example. You only pick these cases when you test them.
Okay.
For quite some time now, what we test as a country is about 3,000.
Okay.
It's about 3,000 tests a day.
Okay.
So and then you look at 3,000 divided by 36 states plus the FCT. That gives you roughly less than 100.
Okay.
A day per state on the average. So that means we are only testing like a state like in Lagos. On the average, if you want to spread the total number of states, that means we are testing 100 out of, in the FCT we are about 4 million, 100 on the average. All right, Lagos about 20 million, 100. That's definitely not enough. Okay. So the numbers, and a lot of people know. Some people have refused to come out to take these tests. A lot of people have come down with cough, catarrh. That most likely, has been COVID.
Okay.
But they didn't come. Some don't disclose. Some don't even come out to do tests. Some do tests and they refuse. To be admitted.
Okay.
So it's basically the numbers. To me, I think the numbers are more than even what is reported. Because another thing is that about 70% in the FCT, 70% of cases are asymptomatic.
Okay.
That means they're practically normal. It's just probably they were contacts of symptomatic cases. That's where they probably took the test for maybe they want to travel or one thing, and then they found out that they were positive. Okay. So that tells you that there's a whole lot of critical mass of people who are positive, asymptomatic, and still moving around.
Okay. So there is also this misconception too, that the sun in Nigeria is actually what helped us, because people like Bill Gates and co, they actually said that we are going to the street of Nigeria will be burial grounds as at when the COVID-19 started. So did the sun really help? The sun did it really help us in?
Well, I know I don't know if the sun in Nigeria is as hot as the sun in Saudi Arabia.
Okay.
Or in Dubai.
Okay.
This Saudi has probably maybe 3 times. I'm not sure of the exact number, but close to 3 times the number of infections that we have. And a few days ago, the temperature in Riyadh, which is the capital of Saudi Arabia, was 43 degrees Celsius.
Wow.
In Dubai, it was like 42. United Arab Emirates.
Okay.
In of course, basically in the Middle East, anyone that has been there know that there's no sun here. So, and this is rainy season.
Yeah.
So, even if you say, even during the dry season, our dry season is not still as hot as their dry season. So even in the rainy season that we are now, there's no justification that the sun is actually, reducing the infection rates. There's nothing to justify because the sun in the Middle East is hotter than the sun in Nigeria. And even there are some countries whose temperature are colder than Nigeria, and they have least number of cases than Nigeria. So there's no justification.
So the sun is not really the help here.
It's not a known help. It's just a hypothetical.
So now chloroquine and local herbs can cure it. What do you have to say about that?
Well, like I said, it's an hypothesis.
Because they say even now in the country that you were the one telling me the other day now that chloroquine is now scarce in the country.
Yeah. So, yeah. So these things happen in every pandemic.
Okay.
And
there are people holding it, or there are something somewhere happening. Are people holding it, or it's just like that?
Yeah, basically, like I said, in every pandemic, there's always, would I say,
somebody benefiting.
Somebody, hypothesis
about
of
it.
Effective drugs. And in the scientific world, hypothesis is allowed. You start with a null hypothesis that, for instance, chloroquine can treat COVID-19. It's allowed in science. But it's just an anecdote. You need to bring scientific evidence to prove that. So that has happened, all right? And, of course, there were some studies, scientific studies, even before the coronavirus, because this is a coronavirus 2. There are other coronaviruses. So I think there was a study some years ago that chloroquine was effective in controlling coronavirus. But again, that is also an hypothesis for COVID-19, which is a different strain of the virus. Even though a lot of people like the doctor, the female Nigerian trained doctor in the US, who also said that she has treated a whole lot of patients with chloroquine and they recovered. So that is it's not something that one should discard coming from a clinician who has patients and who is really experiencing the effect of these drugs. But again, in science, you need to prove it. You need to give us the data. You need to, bring out, the whole analysis to show that it is not just an instantaneous finding. So the issue of infodemics comes in again. With that, a lot of people, are buying chloroquine. A lot of people are taking it,
abusing
it. But there's nothing to really show. Probably maybe in the next 1 year or 6 months, you will really get to know whether chloroquine, is effective or not, because there are still studies going on right now. So, but there's basically no scientific evidence yet to support that assertion.
So basically, chloroquine or local herbs is not the answer.
Yeah, local herbs has always been in the African traditional culture.
Okay.
Local herbs has always been practiced. Our grandfathers, fathers, and all that. Even up till now, even educated people still run back to local remedy. Nobody says it's entirely bad,
Okay.
but you need to prove, because before a drug is cleared to be administered to people, then you have to be sure that the number one thing is safety.
Okay.
Is that drug safe? And that's why you try it in laboratory animals first,
Okay.
to see whether it's safe.
Okay.
If it is safe, then the next thing, is it potent? Is it effective?
Okay.
So safety first in laboratory animals, and then this is safe. Then you know the dose, the safety dose, the safe dose, and then you can now come to the next level of the clinical trials in humans now, to see whether it's safe now, but is it potent?
Okay.
And then that's the stage 2 of clinical trial, phase 2. Then the phase 3 now, the phase 2, you're just testing it within a few cluster or cohort of people.
Okay.
And then, because you need to also look at, a drug can be safe, can be potent or efficient, but it may also have life-threatening side effects.
Okay.
So in the phase 3 now, you test it in a larger population to really see, over a longer period of time, to really see whether this safe and potent drug does not have life-threatening effects. So those herbs, well, some of them have very good pharmacological agents in there that can be, used. In fact, some of them are actually used in producing, orthodox drugs.
Okay.
But there still needs to be a whole lot of processes before one can say that.
So based on your explanation now, I think some days back, if not some weeks back, I was reading one of the headlines that Russia, they brought their vaccine for clinical trial here in Nigeria. I don't know how far that information is. So back to infodemic.
Yeah, basically, I think I also read that in the news that given some vaccine to
Nigeria for clinical trial.
But again, of course, the federal government will subject it, under phased testing and all that before it goes to, because basically the word is still prevention is better than cure. And for now there's no pharmacological or pharmaceutical agent that can completely cure COVID.
So we are still
the factors or the measures that we are looking at are the non-pharmaceutical measures, like physical distancing, wearing face mask, hand hygiene, and all that. So, but now every vaccine, there's, even in Russia, there are a lot of questions within Russia that they didn't spend the usual. There's a minimum period of time you need for that phase trial, phase 1, phase 2, phase 3. But in fact, there's a question whether is it an issue about nationalism. Sometime in India, some people made a statement that, of course, any country that brings out a cure for COVID-19 will become a superpower. Because you're talking about 6 billion people in the world.
So everybody.
So if you sell it $1 per vial, that's a whole lot of money. So the issue is that, is it about nationalism,
or is it truly a vaccine?
Yeah, but again, let's also give Russia the benefit of doubt that they have also done everything that is necessary. It's for us, left for us as a country to also conduct our own checks before we allow it to be administered to our people. But again, I don't also want to discourage, because if truly the vaccine is efficient, then it's going to be very useful in the response, because we cannot continue, we can't continue to be at this kind of a risk, where you be a second wave,
Okay.
especially with people discarding preventive precautionary measures.
Okay.
So it will be a very good thing if the vaccine is effective and people take it and get prevented from getting the disease.
So lastly, doctor, the last misconception is that the whole COVID-19 thing is malaria. So what do you have to say? It's not. This one is not even just what I've heard somebody said to me. Why are we disturbing ourselves? That this thing is just malaria. So let us just treat it the way we are going to treat malaria. So what are you going to say about that?
I watched on national TV, I think NTA or AIT, a very well highly placed person in the country who got infected and was admitted, I think in the early days of the COVID, I think around March or so. And when he came out of the treatment,
It has Raymond
Dr. of the AIT, and they asked him, and he said, there's no difference between COVID and malaria. You know, so personally, I don't want to blame him for that, because if you look at the known symptoms of COVID, you know that they also, this is a flu-like symptoms. You have fever, you have cough, you have malaria, you have diarrhea, you have abdominal pain, maybe catarrh. Those are symptoms that also can also come with malaria. So I don't blame a lay person for saying that, But the question now is how we've had malaria. We've been with malaria for a long time. But we've never known how how somebody can go to a meeting, like the late chief of staff to the president. And then, in that meeting there were governors and, who came in contact with him. And then few days or weeks later, they also tested positive. That has never been known of malaria. In fact, I can help you if you have malaria.
Malaria is not communicable.
It's not communicable. So, yes, it may be similar symptoms. But the difference is that COVID is communicable. All right, malaria is not. And then there's nothing that says that malaria and COVID cannot coexist. These things, malaria is caused by mosquito bite. So if you are infected with COVID and you are bitten by mosquitoes, you can also come, down with malaria. So COVID is COVID, malaria is malaria. Malaria is not communicable. COVID is communicable. Malaria does not cause respiratory difficulty. COVID does. Malaria is not known to kill people within a short time. But COVID, there's been evidence, that's so.
So thank you very much, Dr. Ini Ekong, for taking our time to educate us on some of these misconceptions. There are still so many misconceptions out there, but as we gather some of them, we'll still call you again to come and clarify some of these things for us. Thank you very much, sir, for coming onto our channel today. So if you have enjoyed this session of misconceptions or myths about the COVID-19 pandemic, do not forget to join us for the other section that we are going to be having as we gather more facts about some of the misconceptions about the COVID-19. Doctor is always here to help us out on this. So if you have enjoyed this broadcast, do not forget to subscribe to our YouTube channel. Don't forget to follow us on Facebook. Don't forget to follow us on Twitter. Do not forget to also follow us on Instagram. Thank you very much.